Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Jack, I understand that you're in pain, but if it would be okay, I'd like to ask you a couple of questions about your past experiences, just so that we can kind of get to know each other a little bit.
Sure.
Why did you make an appointment at this time? You know, what kinds of treatment do you think you need?
Well, I need to get this guy worked on. I didn't want to come in because I thought I could just kind of wait this thing out, and I would usually prefer just to wait it out than to come in, because usually when I come in to a dentist, his working hurts more than the tooth hurts. So I was just going to let it ride and clear itself up, but it doesn't seem like it's going to. It started really hurting about 10 days ago, and I tried to make it through, but it's not going to work, so I had to come in.
Tell me about your last dental appointment. When was it? What'd you have done? What was it like?
I think it was about 6 years ago. Yeah, maybe. Might have been even longer. They put in like 6, 8 injections all on one side, and the side of my face got numb, but it didn't seem like that tooth got numb. And every time he got anywhere near it, it's lots of pain. And it was like when I was a kid, it was kind of the same way. Just I went to the dentist, and it was a lot of pain.
So being hurt seems to be the big problem.
Yeah, and you know, my family doesn't seem to take well to Novocaine or any of the anesthetics either, so maybe it's hereditary or something, but I don't get numb.
What do you think the most difficult or fearful things are about going to the dentist?
Pain, just the pain. You know, if it didn't hurt, fine, no problem. You know, but I can't get numb, you know.
Okay. Afraid of anything else besides dentistry?
Not really, you know. Pain, but it's just the pain in my mouth, because I can like slice my hand at work, and you know, blood and all that stuff, and you just kind of patch it up and you go back to work, no problem. But you know, pain around those teeth, the bones, and all that stuff.
Okay. How'd you feel last night before your appointment this morning?
Yeah. You mean, was I worried or something? No, I didn't think so, because I thought all you do is just kind of take a look at things first, and then we'd have to make another appointment. That's when the real stuff would start, rubber dams and the injections and stuff. But,
I see.
Last night wasn't so bad.
Okay. What could I, as a dentist, do or say to make it easier for you?
If you've discovered some process so it didn't hurt, everything'd be fine, you know, or that we'd just make sure that I was numb.
Kind of feel like you'd just like to be bonked on the head.
Yeah, if you could just knock me out totally and then just wake me up at the end of things and go, it's all done, everything's fine.
Okay. What kinds of things could I do that would make it worse, more difficult?
Just, you know, if I wasn't able to get numb, if everything was to hurt, you know, or to surprise me, you know, if I don't know what to expect and all of a sudden you're working on something and I don't know where it's coming from.
Okay, Jack. Appreciate you telling me all these things. It's difficult to see if we can't get you out of pain now.
All right, good.
Jane, it's really good that you came today. You know that's the first step in getting over the kind of problem that you've described over the phone. You should be real pleased with yourself. Make sure you do something good for yourself today.
I am.
It's a treat for having done that. Why'd you make an appointment at this time? Do you think you need treatment now?
Well, I wouldn't have come at all if I wasn't in pain, because I can't stand the drilling. But I would like you to just take this tooth out so I can get out of here. A couple of months ago, a filling fell out, and then about 2 weeks ago, I think a piece of the tooth broke off. And anyway, about 10 days ago, it started to hurt, and I tried to wait it out, but I can't. So I came along.
Tell me a little bit about your last dental appointment. What you have done, what was it like?
Well, it was a root canal, and I couldn't let him finish it. I was perfectly fine until he gave me the injection. And then about 5 minutes after that, my heart started pounding, and my fingers and my arms became numb, and I had a great deal of difficulty in breathing.
Do you feel pretty uncomfortable now?
Yes, I guess I'm just remembering what that was like. He said I might be allergic to the Novocaine, which makes a lot of sense because my reactions to the dentist have been getting worse and worse. And my doctor said that he thought maybe it was the adrenaline in the anesthetic. It certainly scared me at the time. I think it scared the dentist, too.
What do you think are the most difficult or fearful things about going to the dentist?
I don't think I'm afraid of dentistry. I'm just scared of what will happen. I think that I might be allergic, and so that might trigger an attack, and then I would have difficulty breathing, and my throat might close up.
I see.
And
are you afraid of anything else beside dentistry?
I'm just worried about having a physical attack as a result of anesthetic. And I do everything I can not to put myself in the situation where I might have one.
Seems reasonable. How'd you feel last night before today's appointment and today before you came in?
Well, a little worried last night that I might have an attack. I guess it could be in my head, but I don't know. That sensitivity to the drug is there, I think, and I'm really afraid that something might happen, something bad, and I die in the dental chair like those people you read about.
What kinds of things could the dentist say or do to make it easier to go to the dentist?
Well, not give me any adrenaline or find a new anesthetic that doesn't, that I don't have a sensitivity to, perhaps. I don't know what he could do. I don't feel like I'm in control of the responses I have.
What do you think makes it worse? What could the dentist do or say to make the appointment more difficult?
I hate it when the dentist is in a hurry. I really hate it. I'm afraid also that he might not understand the problem that I have with the anesthetic, or that if something bad happened, he wouldn't know what to do. That's why I like coming here, because the emergency equipment is here at the hospital, and I feel like if something bad happens, then someone's going to take care of it.
You come to the right place.
Thank you.
Maureen, I'm glad that you came in today. I understand that you're having some problems with your teeth.
Yes.
Why'd you make an appointment now?
Well, I made an appointment only because the pain was bad. I didn't want to come, but I just can't stand the pain any longer. I had a filling that fell out a few months ago. A couple weeks ago, a piece of the tooth broke off, and it's been getting steadily worse.
I see. Tell me about your last dental appointment. What'd you have done? What was it like?
It was like every other dental appointment I've ever had. It was about 6 years ago. The dentist got me in the chair. All he seemed interested in was whether or not I had insurance or if I was going to pay in advance for the work. The worst part was that I told him I wasn't numb. He told me he had given me enough Novocaine to make anybody numb, that I should just hang on and take it.
When was this?
7 years ago.
I see. What do you think the most difficult things are about dentistry for you?
Oh, feeling trapped. Once you get in that chair, there's absolutely nothing you can do. You're completely out of control. The dentist can do or say anything he wants to do to get the work done. He doesn't answer questions. He doesn't try to make you feel comfortable. The dental hygienists make you feel guilty because you don't have perfectly clean teeth. They don't treat you like a person.
I see. Are you afraid of anything else beside dentists?
Well, not really. Well, doctors are pretty close to dentists. Dentists are worse, but doctors, you can go into their office, going through something like a pap smear, they don't tell you what you're doing. It's completely depersonalizing. They don't treat you like people either. That's the only thing I will not put up with.
How'd you feel last night as you thought about today's appointment, or this morning as you anticipated it?
Well, I tried not to think about it at all. I just tried to put it out of my mind and stay calm. I just didn't want to think about it until it had to happen.
I see. Are there things that the dentist could do or say that would make it easier for you to receive care?
Well, all he would have to do was let me ask questions, answer the questions that I ask of him, explain the different choices to me. That's all I want to know. It'd be really nice if a dentist could treat me like a rational, intelligent person.
Mm-hmm. What do you think the dentist could do that would make it worse, make it more difficult?
When he makes fun of my fears, that's the worst part. When he gets annoyed because I'm afraid. When he doesn't answer the questions that I ask, I feel like he has something that he's trying to hide. That's the only reason that he won't answer questions. There's no reason why a dentist should take it personally just because I'm uncomfortable and I hate going to the dentist.
Well, I appreciate you telling me these things. These are serious problems, and I think that we can begin to work together on them if you like.
Yes, I'd like that.
Good. Well, I'm glad you came today. Phyllis, it's nice to meet you. Glad that you came today.
Thank you.
It's the right thing to do. Why'd you make an appointment now?
Well, I've been putting it off for years, years. And I'm sure that I have all kinds of things that need doing in my mouth. I'm sure everything needs caps or they all need to come out or something. And when the last filling came out, I realized that I really had to get the courage together to come.
I see. Well, tell me about your last dental visit. What was it like? What'd you have done?
It was awful. It was just a filling. It was silly. But I was shaking like a leaf waiting for him to hurt me. And afterwards, my whole day was ruined. I couldn't go to work. He gave me pain medicine, but it didn't work. And it just makes me so nervous to go and hear that I need gum surgery and everything has to be capped. And I didn't go back and I didn't go to the specialist that he told me about either.
What do you think's most fearful or difficult for you about dentistry?
Well, it makes me nervous. I'm a fairly nervous person, and I tend to get depressed very easily, and I worry about all the things that can go wrong in my mouth, you know. And I think that's silly. I'm sorry. I just get very scared about it.
Are you afraid of anything beside going to the dentist?
I don't like to fly, and I don't like driving in the back of cars. And I used to be afraid of elevators, but I got a job in town now, and now I ride elevators.
That's good.
My doctor says that I get easily depressed and I worry a lot about other people, and so he gave me some tranquilizers.
How'd you feel last night and this morning before you came down?
Terrible night. Just awful. I couldn't sleep. I even had diarrhea. I was so nervous. And on the way here, I almost had a wreck. I was driving so badly. I was so nervous. I wish I could just be better. And I sat down in the car park for about 10 minutes, talking myself into coming up here. So I even took a Valium before I came, but I don't know if it's done any good.
What could I, as a dentist, do to make it easier for you, or what could I say that would make it less difficult?
Well, you could just be nice and kind and polite, and maybe knock me out, put me to sleep or something, so that I don't know what's going on. Maybe that would do it.
What could I do that would make it worse or more difficult?
I really hate it when they hover over you, you know? And they just make me feel so closed in when they do that. I don't like that.
Well, you've done the right thing to come today. I want you to do something really good for yourself. Treat yourself for having come so that you get a little reward for making the first step.
Oh, yes, I will.
That's good.
Thank you.
Steve, now that we've had a chance to talk a little bit about your general health, I'd, with your permission, like to have a chance to examine your teeth and your gums and have a chance for us to kind of gather some more information. Would that be okay with you?
Yeah, sounds good.
Good. Tip you back just a little bit. The reason for doing that is just so I don't have to crook my neck too much. Is that a comfortable position?
It's okay, I guess.
Okay. The chair moves around a lot, so if you need me to move it at all, just ask me and I'll be glad to try and find another position that would be more comfortable for you. Just try and give me some feedback as we go along, and then I'll try and honor your requests. Now, what I'd like to do in the beginning is just to use my fingers and to have a look at your teeth and gums. That be okay?
Yeah.
Okay. Would you like to watch what I'm doing? I can give you a mirror here.
Okay.
Why don't you can hold that mirror, and then if you'd like to watch what I'm doing, you'd be able to see it. If you don't want to use it, that's okay too. Now, if it'd be all right with you, I'd like to use a small mirror to look at your back teeth. Can I have the mirror, please? And I'll show it to Steve. Okay. That's just a small mirror.
Okay.
Would that be all right?
Yeah, my back teeth are very sensitive, though, so be real careful.
Okay, well, I'm glad that you told me that. Now, I'll try and be very careful. Again, we'll do the same thing we did before. And this time, what I'd like to do is to ask Quinn to write some things down. What I'm going to be doing is using a lot of jargon. And you won't understand too much of it, but when I get finished, I'll be glad to explain everything that I saw. Okay, Quinn. Number 1 is missing. Number 2 has an occlusal amalgam. And number 3 has an occlusal amalgam. That's very good, Steve. Now I'd like to introduce you to another instrument, if that would be okay. Quinn, can I have the periople, please? Thank you. Steve, this is kind of like a ruler. It's for measuring how healthy your gums are. It's rounded on the end, and it's calibrated. And when I use it to feel around your gums, you'll feel it, but it shouldn't hurt. Would it be okay if I were to try and use the probe around one tooth just so you'd see what it was like?
Yeah.
Okay. I'll be real careful and real gentle.
Okay.
Okay?
Mm-hmm.
Good. I'm going to tell Quinn some things to write down now so that she has a record of what we talk about. Okay, Quinn, on the distal buccal of number 3, you have 4, 2, 5, and on the distal lingual of number 3, I have 7, 2, 3. Steve, that's very good. Now, if it'd be okay with you, I'd like to just have a look at the soft tissue in your mouth and at your temporomandibular joint. Quinn, can I have some 2x2, please? Thank you. Steve, could you stick your tongue out for me? I'm just going to hold on to it for just a second. Have a look underneath it. That's great. Thank you. Okay. Steve, it's really good that you came in today, and I'd like to tell you just a little bit about what I've seen. Basically, first of all, while you have some problems and you know you have some broken teeth, things are really pretty good. I think that the problems you have can be repaired, and you can have a really, really good result.
Well, that's good.
The second thing I'd like to tell you is that it's really good you came now, because you have some problems, and those problems would have probably gotten worse if you hadn't done something about it. So it's good that you're here and approaching solving the problem. Mm-hmm. Do you have any questions about what we've done so far?
Yeah. Do I need any root canals?
That's a really good question, and one that worries a lot of people. Right now, I don't know. What I'm going to be doing is asking you to have some x-rays taken of your teeth. And when we've had a chance to look at the x-rays together, then we'll be able to make some recommendations about what you might do and whether any treatment like that's necessary.
Okay.
Do you have any other questions?
Not right now, but I'm sure I'll think of some later.
Okay. I hope you will have a chance to ask me again, because usually when you leave, you have some questions that you didn't think of during the exam itself. I'd like to tell you one other thing, and that is that oftentimes between when you first come in and when we have a chance to do something about the problems, sometimes you end up with a tooth that hurts, a gum problem that starts to bother you. If you'll please let me know, there are some medications I can give you that'll make you more comfortable and allow us to kind of plan in a very thoughtful way your treatment without having a bad experience before we have a chance to approach it in a real systematic way.
Okay.
I really appreciate you coming in today, and I think you've taken the first big step in getting here, and that things are really going to work out okay.
Well, thank you. Jack, today what I'd like to do is to practice getting numb.
Why do we have to practice? Can't you just do it?
Well, it's a good opportunity for you to become a little bit more comfortable with the procedures that we do. And you're pretty tense right now. A chance, and that's normal to be tense. It's a chance for us to practice, and it's a chance for you to get used to the smells and noises and everything that we're going to be using, and for me to kind of see how you do, and for you to know what I'm going to do, so that nothing's a surprise. And so we do it when we don't have any pressure to get a filling done, you know, a chance to just try it all out and see what it's going to be like. Do you know what topical anesthetic's for?
No, not really.
Okay. Well, what we're going to be doing is putting a little ointment on your gums, and it's to make it so that you don't feel a needle.
Oh,
Okay? The reason that most injections are uncomfortable is either because of that needle puncture or because we go too fast.
Yeah.
We go real slow, and at the same time, we use this topical ointment to make it feel more comfortable. So I'd like to kind of show you what it's like and have you experience it a little bit, get a feeling for the taste of it and what it's likely to feel like. And at the same time, I can see how you're going to do.
Okay.
Okay?
Sure.
You ready to begin?
Yeah, I guess.
Okay. Kathy, can I have the topical one, please? Okay. What I'm going to do is just, if you stick your tongue out for me just a little bit, I'm going to put a little on the end of your tongue and just dry it off a little bit. Put some right here. Okay, and I'd like you to just experience what that's like. You may find that your tongue begins to feel a little bit numb.
Yeah.
Mm-hmm. What's it feel like?
It's kind of like pricks, little. Well, it's getting numb, like when your foot goes to sleep.
Right.
Yeah.
Right. Okay. You'd probably even find that it gets a little warm, just as if your foot were going to sleep, but it won't be uncomfortable. Okay. Now we're going to do the same thing then underneath your lip here. Kathy, if I could have a little more topical. Good. What I'd like to do first is to dry it off a little bit. The reason we dry it is because the topical works better when it's dry. There you go. Okay. I'm going to put the ointment on here. We're going to leave it on for about 2 minutes. That's about how long it takes for it to really get good and numb.
Okay.
Okay, that's just about 2 minutes now. And what I'd like to do is take this out now. Kathy, if I could have my probe, please. Good. Let me put the mirror up here for a second. You can kind of see what I'm doing. What I'd like to do is just to touch this side over here that's not been anesthetized. You can feel what that's like. And then let's just touch this side over here. Can you feel the difference?
Yeah, this side's duller.
Good. Okay. And the idea there is that this side now would be very comfortable for getting an injection and getting numb. Do you have any questions about that, Jack?
No, not right now. I'll probably think of some when I get home.
Okay, well, if you think of any, please be sure and ask, okay?
Okay.
Jack, we've practiced the topical anesthetic. Now I'd like to practice the injection procedure itself. I know you're a little bit tense, and I'd like you just to take a nice big deep breath and just allow yourself to be as comfortable as you can. That's good. If it's okay with you, what I'd like to do is to practice with the cap on.
Okay.
Okay, nice and safe. We won't actually be doing an injection, we'll just be practicing. And that'll give you a chance to see what's going to be happening. At the same time, you can practice your breathing.
Okay.
Okay? Ready to begin?
Yeah.
Okay, good. This area is numb now, just as we practiced that with the topical anesthetic. Kathy, pass me the syringe again. With the top on, it's just to practice. Okay. Place it just here under your lip. Good. Take a nice big deep breath. That's good. That's really good. Good. Nice and slow. Let it out slowly. Anesthetic syringe is going to stay there about a minute, just to give it time so that we can work very, very slowly and make it as comfortable as possible. Okay, that was really good, Jack. How are you feeling?
Okay.
Okay, that's good. Your breathing was good.
Thanks.
Okay. What I'd like to do is just have you catch your breath for just a second. And then we'll practice again. This time we'll practice without the cap. But I won't give you an injection. It'll just be a practice.
All right.
Okay. Are you ready?
Yeah.
Okay. Same thing again. We have the topical anesthetic here, and it's nice and numb.
Uh-huh.
Kathy will pass me the syringe. Go very slowly. Okay. Again, about a minute. And we'll give it a chance for us to go very slowly. Okay. That was really good, Jack. Good breathing.
That thing is long.
Well, it's long just so that I can see, so I can place it accurately. Very, very little of it actually goes in your mouth. Would you like me to show you? Just take the cap off, Cap.
I know it sounds silly, but I'm always worried that thing's gonna go in too deep and come out the back of my head or my neck or something.
Just this little bit on the end here actually goes under your gums.
Okay.
It's long just so we can see better. Good. All right, take another break.
Okay.
Just breathe and relax a little bit.
Yeah.
And then when you're ready, what we'll do is we'll go ahead and do the real thing.
Okay.
Do you feel like you're ready to go? Ready to do it?
Yeah, sure.
Okay, good. You're doing really, really well. Okay, Kathy. Suzanne, it's really good that you're here today and that we have a chance to work on our rubber dam rehearsal. I understand you've had some problems before with rubber dam.
Yeah, it really makes me nervous because I feel like I can't breathe when I wear it.
Well, that's why we have a rehearsal. It's a chance for you to practice and for me to show you some tricks so that you can be more comfortable. It's also a nice step in the direction of getting some broken teeth fixed, something you have something good to show for, and allow you to look better and feel more comfortable. So it's a chance for you really to achieve something, nice, easy step. If it's okay with you, I'll show you what the rubber dam is now. It's a thin sheet of rubber. It's just like this. Okay? You have some holes punched in it for your teeth. And it's going to go up, right up here. Let me just hold the mirror for a second. You're going to see what I'm doing. Okay. It'll go right up there like that.
Yeah.
And the reason we use the rubber dam is that it allows your saliva and your tongue and everything to be safe back behind the rubber dam. And all the debris and all the medicines that I'm going to be using will all be out here. You won't have to swallow any of them. Okay? You understand?
Yeah.
Good. Okay. Now, there are a couple of skills you need when we work with the rubber dam. One is, Kathy, if you'd hold that, please. One is that you need to be able to breathe through your nose. Okay? You can breathe through your mouth, but it's sort of comfortable to breathe through your nose. And I'd like you just to close your mouth and try and breathe through your nose. Make a nice big breath. Okay? Try again, a little bit deeper this time. That's very good. Now, you having any trouble breathing through your nose?
Well, I'm just getting over a cold. So it's not real comfortable, no.
Okay. Why don't we give you an antihistamine, and that'll allow your nasal passages to be a little bit freer, and you feel a little bit more comfortable when you're breathing through your nose. Is that okay?
Yeah.
Good. Okay. Now, the other skill you need is being able to swallow. You'll be able to swallow with rubber dam on, but sometimes it feels like you need a little help. Kathy, can I have a suction, please? Good. This is a suction straw, and at the end here, we'll suck up saliva. The way we use it is we just turn this little knob here, you put it in your mouth.
Yeah.
Good, just like that. You feel it sucking up the saliva?
Yeah.
Okay, what I'd like you to do is to hold it yourself. Just take it like that, turn the little knob.
What,
That's right, just like that. Okay, and then put it in your mouth. Feel the saliva being sucked up. Very good. Okay, what I'd like you to do is to hold on to that. That way you've got it, and you can use it if you need it. You don't have to depend on us. Some people don't need it at all, and other people find that it's really helpful. Do you understand? Okay. Are you ready to begin a little rehearsal now?
Okay.
Okay. Do you have any other questions before we start?
No.
Okay. And you know that you're in control, and if you want me to stop, all you have to do is just wave at me, okay?
Okay.
Good. Okay, Kathy. Let's have your rubber dam. It goes just like this. And some dental floss to hold it down. You're doing a good job, okay? Do you need the suction? Okay, we'll put some dental floss in on the other side. This is a real opportunity to learn some new skills and to feel a whole lot more comfortable. You're doing really, really well. Okay. Kathy will trim the dental floss so it's nice and neat. It'll look just like a Christmas package. Okay. Now, feeling pretty good? I think you're doing pretty well. Why don't you take the mirror and have a look there and see how you look.
Oh, no.
You can see. And the reason we do this is so you'll know what it feels like before we have to do it for the real thing. Okay? Now, how are you doing on breathing through your nose?
Okay.
Good. Okay, nice, big, deep breaths. Right? Make yourself feel real comfortable and relaxed. Why don't you try the suction, too? Let's do that. Bring it up here and just bend it a little bit so it's easier. Good. Turn a little screw. Put it right back behind the rubber dam, just like that. You feel it sucking? Good. Okay, that's really good. Do you feel pretty comfortable using that? Why don't you try one more time? Okay? That's perfect. Just put it right behind. There you go. Good. That's really good. Okay, now what I'd like to do is to leave the rubber dam on for, about 5 minutes. And kind of simulate about how long it would be if we were going to do a simple filling in front teeth. Okay. During that time, I want you to use the suction, and I want you to breathe very comfortably, okay? If you need for us to stop, all you have to do is just raise your hand and let me know.
Okay.
Okay? Good. And just relax now. Allow yourself to breathe, to use the suction if you need it. Okay, it's been just about 5 minutes. You've done extremely well. Simulated just exactly what it would be like if we were going to be doing a filling in this area. What I'd like to do now is to take the rubber dam off.
Yay.
Okay, Kathy will take the dental floss over there. And then what we'll do is we'll let you have a rest, set you up a little bit. And after you've had a rest, if you feel comfortable, we'll try the rubber dam in another spot. And so you can feel what it would be like there as well. She did really, really well. I'm real pleased. You should feel like you've accomplished something.
Lindsay, I know dentistry is stressful for you, and I'd like to show you some exercises that could help make it easier for you.
Okay.
I'd like you to practice these exercises at home about once a day. There'll be 3 exercises, and I'd like you to try them in a particular order. They seem to work best that way. When you're home, try them in a comfortable chair, but not too comfortable so you fall asleep.
Okay.
And when you're done, I'd like you to write some notes about how well they worked for you. And then you'll bring those notes back to me, and we'll talk about them before your next appointment.
Okay.
The first exercise is a muscle relaxation exercise in which you get to feel the difference between tense muscles and relaxed and loose muscles. What I'd like you to do is turn into kind of a Raggedy Ann doll. I'm going to show you right now some upper torso muscles in the upper part of your body. There's some other muscle groups that you could also try.
Okay.
First, I'd like you to tense your stomach muscle and feel the tension.
Make it tight.
Right. Now relax. Okay?
Okay.
Feel the difference? Now try your chest. Take some air in. Hold it. Feel the tension. Let go. Okay. Now we'll do shoulders. Hunch up your shoulders. Really push hard. Feel the tension in your shoulders and neck. Now let go. Let your neck fall forward. Let your head fall forward. You can close your eyes if you want to. Good. You should feel your shoulders and neck getting warm and loose and limp. That's how you know that they're getting more comfortable.
Okay.
All right? And when you're comfortable, when your body is comfortable, the rest of your mind tends to follow.
Okay.
Let's do one more right now. Let's do your jaw muscles, these muscles right over here. What I want you to do is grit down. Okay, are you gritting down? Okay, now let go. Do you find there's a space between your teeth? Good. That's about the position I'd like you to keep, especially when the dentist isn't working on you. It'll make it much easier on you.
Okay.
Okay? That's the muscle relaxation exercise. We'll put you in the chair a bit early. You'll do this and the next exercise, which is a breathing exercise. We'll give you time to kind of get comfortable. Okay?
Get ready. Okay.
Now, the breathing exercise will give you more, will provide you with more oxygen, and it'll help you focus away from the dentistry as well. And you've got to concentrate on your breathing.
Okay, and away from the dentist.
Right, away from the dentist. The first thing I'd like you to do, okay, is sigh as you're exhaling. When there's no more air left, I'd like you to hold your breath for a count of 5, and then take another normal breath. Okay? Hold it. 1, 2, 3, 4, 5. Okay. Now the second part has to do with slowly pushing your air out. I'd like you to slowly push the air out of your lungs, only focusing on the exhale. Okay? The slower the better. Try to begin for a count of 6 or 7, slowly pushing the air out. Okay? Three, 4, 5, 6. Okay, take another breath and match it. 2, 3, 4, 5, 6, 7. Okay, keep on doing it. Good. Good, you're doing it really well. Again, you're matching one breath to the other.
Okay.
When you practice at home, you can even get up to 10. The idea is to slow your breathing down as much as possible. And you have to concentrate when you do it. You can't be thinking of your shopping list or how terrible and miserable the dentistry will be.
And close the eyes helps.
Right, closing your eyes sometimes helps.
Okay.
Okay, helps you concentrate. Once you do that for a couple of minutes, I'd like you to do an imagination exercise. Is there a place that you can think of that's kind of special to you and safe and warm?
And relaxing at the beach on a raft.
On a raft? Great. You think you could imagine being on a raft? Great. Well, I'd like you to focus on one sensation at a time and begin to be there. Because after you get really comfortable, after you relax your muscles, after they become nice and heavy, after you turn into a Raggedy Ann doll and begin your breathing exercise and really begin concentrating on your breathing, you really feel you'll be in control of your mind. And then I'd like you to do this imagination exercise.
Okay.
Okay?
Okay.
Great.
Mary, just give me a big sigh, like this. That's good. Just let these muscles just relax just a little bit if you could. That's the way. Now what I'd like you to do is just to take a couple of big, long breaths now for me. Just good. And try again, and just a little bit slower this time. That's good. That's very good. Now, I know you've had some problem in learning to relax in this setting, so I'd like you to follow some instructions with me and just see if we can't enhance your relaxation here. Now, can you imagine that you were getting up this morning, the alarm clock was going off, and your boss called, and she said, Mary, you've been such a valued employee and you've been working too hard, and we just think you should go back to sleep this morning, take the morning off. Can you kind of imagine that? Improbable as it is. Okay. What I'd like you to do is just to see if you can imagine yourself in that kind of situation. Let your muscles relax. Just cross your feet there. And I'll guide you through 5 breaths. And during that time, you'll just have a chance to put yourself back in that scene. So take a big breath. This will be 5. That's good. And as you exhale, just imagine yourself under the covers, feeling warmer and more comfortable than you've ever felt before. And your eyes can be open or closed, it doesn't matter. Good. And now, big breath. 4,
Slowly exhale, feeling the fuzziness of the covers. Let your forehead muscles relax, your shoulders. Good. Good. And 3 big breaths. Great. Feel yourself sinking heavily into the bed, feeling good, more and more comfortable, feeling relaxed. And 2 big breaths. Feeling all the muscles of your face and your frame just more and more relaxed. And 1. Sinking more deeply, more comfortably into the chair. Feeling very, very good. I'd like you to continue those breaths now. When you feel like you're ready to proceed, to give me a little signal with your finger.
Doug, I'm glad to have the opportunity to meet with you today. I understand from your dental history that you've had a gagging problem since you were about 10 or 11.
That's for sure. I had a dentist that got angry with me when I was about 11, and I've avoided the dentist ever since. The last time I went, I believe, was about 8 years ago.
What kinds of things in the dental environment tend to make you gag?
X-rays, or even the thought of them, and the rubber dam. Yet I can brush my teeth, no problem, and I can eat just about anything.
Okay. Well, that's not unusual for some things to set it off and other things not to. Gagging's kind of an interesting problem because everybody's capable of gagging. It's a reflex that we all have. But it's kind of like tearing. If we get something, an irritant in our eye, the eye will tear up, but we can also set it off by our emotions. And gagging's a lot like that. And we can make anybody gag with a tongue depressor if it's back there far enough. And yet sometimes even just the thought of something can make us gag. And that's the part that we need to focus on, to sort of unlearn that hypersensitivity so that when you think about getting an X-ray or putting something in there, that reflex isn't triggered by our thoughts and our emotions. And the first step in this is really to be able to get you to be physically calm and relaxed in this environment, and as you practice some of the things that you need to learn. And how we do that is to teach you some basic breathing techniques that you will practice at home. So why don't we take a couple of minutes and I'll teach you the fundamentals of that. Okay, now that we've had a chance to practice the breathing, I need to get an idea of where we should start. And I think what I'll do is give you this. This is an X-ray holder that you can use. A lot of people find it useful because they can put it in their mouths and they feel comfortable because they're in control and it's not just a loose piece of cardboard. So what I'd like you to do is just to take a nice deep breath and then practice biting on that broad surface. Okay, why don't you try to take a nice deep breath again. Okay, and just put it in there and just try and bite on it. Okay, I can see that.
It's going to take some time.
Okay. Well, in that case, I think this is a real good place to start because it's long and you can put it in there and you can pull it out whenever you need to. Over the next week, what I'm going to have you do is practice your breathing exercises that we've already discussed for 10 minutes a day in the easy chair. Go home, sit down, take a couple of minutes to get relaxed, and then take that and place it in the mouth just like you did. And if it has to come out after a second or two, that's fine. Calm down, take a few more deep breaths, and then do it again. And take it out, take a few more deep breaths, relax, and then do it again. And do it over and over and over. And as you do it more, you'll be more comfortable with it. And practice so that our goal is that you'll be able to hold it in there about 5 to 10 seconds comfortably. And I'm going to give you this chart here, and I want you to just check off every day that you do it so I can get some idea of how often you're able to get to it in your schedule. And then I'll check back with you next week, and then we'll begin to figure out what the next step will be. We need to get you comfortable with being in control of this. Any questions?
Okay. No, we'll see you next week.
Okay.
Well, Doug, good to see you again. How have your practice sessions been going?
Real well. I didn't do it over the weekend, but I did it all during the week. There's my chart.
Uh-huh. Can I see what kind of progress you've made since? Sure. Well, I'm very pleased.
So am I.
I suppose the next question is, where do we go from here? Tell me, what would it be like for you to take your index finger and place it on the inside of your mouth, sort of between your tongue and your teeth?
Not real easy.
Okay, that's sort of the sensation along in there kind of bothers you some. Okay. Well, that gives me an idea of sort of where we might begin. I think what I'd like you to do is go ahead and continue practicing with an X-ray holder, but I want you to continue moving that further and further back.
Okay.
And I want you to be able to get used to having sensations on the inside of your mouth. And I think using your index finger, which is nice and soft and totally under your control, will be a good way to begin. I'd like you to place it back in there, again, when you're uncomfortable, and then pull it back out and work your way further and further back with your index finger, just like you've been doing with the plastic X-ray holder. The other thing that I'd like you to do between now and next week is to use this small X-ray here. And you can bend it a little bit like this, and then hold on to it like this. And what you do is you bite on it, this surface, and you can place that right in the very front. I know that it's difficult as things go further back, but to get used to the physical sensation of having an X-ray tab in there. So you take it like this, right down, and then use your tongue and your hand to go ahead and pull it back out. And again, get used to having that in there for about 5 or 10 seconds at the most. Okay, do you have any questions?
No? We'll
okay.
See you next week.
All right, good.
Hi, Doug. Good seeing you again. Tracy was telling me what a great job you're doing with your skills and your breathing and practicing with the X-ray films. Could you show me today what you've been practicing and
Sure.
tell me what you've been doing, see where we're at?
Been practicing with the film in the front.
Great, okay. Oh, that's neat. Boy, that's a long way from where you've been.
Nothing to it.
Okay, what we'll do today then is we'll take the next step, all right? We're going to try and work and place and practice with the film just a little bit farther back, okay? But to do this, I'd like to introduce a skill of breathing to you. Now, Tracy taught you a skill which is used for relaxation mostly, which is great. And then you've heard of the breathing where they pant like a dog. We're not going to use that, but we're going to find a happy medium in between. And the breathing will go something with a steady rhythm. And the secret is breathing through the nose. And I'll try and demonstrate it for you. And it goes like waves. Okay?
Okay.
So give it a few breaths right now. Let's see if we can do it. Inhale again. Inhale, exhale. Inhale, exhale. That's great. Okay, how about trying it with the film now in the front and try it with the breathing for me. Inhale, exhale. Inhale, exhale. Okay, great. You did good. Terrific. Okay, now, the next step, what we'll do is let's try and place it again right here a little bit farther toward the back. And let's see if you can breathe for me. We'll try and work up to seven breaths, okay? If we can do that, that 7 breaths gives me enough time to take the X-ray, all right? Give it a try. Let's see where we're at. You do it at your own pace. I'll wait. 1, 2, 3, 4, great. 5, 6, 7. Terrific. Take it out. All right. What do you think? You ready for it?
Let's give it a try.
All right. How about a little water before you do it?
Please.
It kind of helps deaden some of those sensory feelings. Great. And then we'll adjust this a little bit more, and we'll give it a go. Okay? All right, here's your film. And don't put it in yet, because I'm going to get everything all ready for us to work with. And if you can hold your head like that for me at all times, see, then I can get the film. So, because if the head moves, then we're going to get a blur on the film. All right? I'm going to get all this ready to go. Get this in place. Okay. Now, when you're ready, we'll give it a try. 1, 2, a little bit faster, 3, 4, I'm gonna go take it, 5, 6, 7, take it out. That's it.
You got it.
All right.
Good.
Did good. Okay. Now, next week, if you can practice with the film again, push it back a little bit farther in the mouth, try breathing, then next week we can go ahead and get the x-ray just a little bit farther back from that. But today, at least, we got the tooth that's bothering you.
We're making progress.
Very good. Terrific. Real proud of you, Doug.
Listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.